Good evening, everyone, and
Good
especially
evening.
thanks to
Good
the
evening.
speakers, Neeti and Sanjoy. This is episode 7 of the Great Debate. We started this show, if you want to call it a show, but I specifically have been saying this is fun come learn activity. Anyone can come and share his her experiences when we talk, and it's free for format talk. I do have some questions. We discuss those points, even if not questions, those may be some points also. Episode 7, and we'll continue the same way. Let me start sharing my screen with some introductions. Attempting to do that. The Great Debate, episode 7, and the topic we have kept today is sustainability of COVID-19 pandemic protocols. Well, planned was a different question, but I'll start with a different one. Quickly, the moderator myself, yours truly. The name is Daman Dev Sood. I have played various different roles I keep doing. My intention is to do a little more for the society, and this is how this session also has come, either for the society or for the community that we all belong to, BCM or Resilience or 2, 3 different names that we have. So Ashwath couldn't join us today. This evening, he was found positive on COVID-19 pandemic infection. Neeti Malik is with us. She is business resilience expert, crisis management and disaster recovery. While I have not mentioned the experience, I believe, Neeti, you are touching about 3 decades. So we have time. And when I
Almost
start,
25 plus years.
35, great, right? 3.5 decades, great.
25, yeah.
I wish
Yes.
many more decades, yes. So
Thank
please
you.
take time when you start speaking. You can add a little more about yourself. I have not done justice to both of you in writing what you are. Our second
That is
expert today
absolutely fine.
is Sanjay De, AFBCI, CBCP, CISA, Executive Director in the BFSI sector with around 3 decades of experience in the industry. Vice President, he's VP at BCI's Mumbai chapter. He loves football. Some people would know this as soccer more than football, and in some countries perhaps. And he's passionate about training. Thank you very much once again, both of you, for joining me in this
Thank you
discussion.
for having us.
Pleasure, Daman.
Thanks. So the topic sustainability of COVID-19 pandemic protocols. Before I go to protocols, as I've said, one expert fell sick this evening. He was found positive. So the first question that comes to mind is it over yet? And
No.
Sanjay, yes, go ahead, please. Yeah.
So the answer is a short no. I'm going first, Neeti, with your kind permission. The answer is definitely
Please.
a short no. The way that you look at the way things are globally,
Yes.
and we shouldn't just isolate our vision to a narrow country specific, state specific vision. But if we look at it globally, there are definite pockets where we are seeing a spike in numbers,
Okay.
a spike in numbers, possibly a spike or a different variant also coming into play. The positive side of it has been that the symptoms seem to be short-lived.
That's
So
good
somebody
news.
who's getting afflicted seems to be recovering within 3 to 4 days,
Right.
and the recovery rate is high,
Good.
and the hospitalization rate is low. So
Right.
you have to look at these three facts and figures, not in isolation, but in correlation together. That
Right.
while the infection rate is going up, the recovery rate is also higher, the
Mhm.
hospitalization rate is low, and the overall effect of the symptoms in itself seems to be pretty low.
All right.
Anybody at any age group seems to be recovering within 3 to 4 days and getting back to a normal.
All right. Great.
Some, especially in the medical profession, would probably call it that this is what it is as an endemic, and it's no longer a pandemic.
All right.
Having said all of that, we all have to manage organizations. We all have to manage spreading of the infection within the organizations.
Right.
We all have to manage, because employee well-being, health and safety is paramount in every organization,
Right.
and in every organization's manifesto or charter of resilience. So if we are to protect that flag, we have to ensure that the protocols that we have been following so far, right through COVID-19, stays for now. How
Right.
long? I don't have that vision. I don't have a looking glass and I don't have a crystal ball, but my view on this, and this is my personal view on this, obviously, Naman, as we have discussed, we are participating as resilience profession and not necessarily representing our organizational
Yeah.
views.
Yeah.
My
Absolutely.
my personal view as a resilience profession is that these protocols, and we'll cover what are these in a few moments
Right.
as I let Neeti speak, is is there to stay for the immediate future, if I might use that word.
Correct.
Over
Great.
to you, Neeti.
Thank you very much.
Thank you
Neeti,
so much.
Neeti,
Please, Aman.
I missed that announcement, so let me make that announcement. Both the experts, actually all experts in all other episodes also, which have happened in the past and will happen in future, experts here are speaking on or in their personal capacities, and they are not representing their organizations. This is an important announcement that I'll now start making in every episode. Over to you, Deep.
Absolutely. Thank you so much. And Sanjay, you just covered it so well, you left very little for me to speak, right? But yes, but yes, the protocols are here to stay. And there are certain things that are easing out. There are certain things that, that will continue. For example, there were many things that we were doing in the very initial stages, when we all landed up in a situation, from the continuity planning aspect, because you picked up the health aspect. I'm picking up the continuity planning aspect.
Right.
We took a whole lot of measures from a continuity planning aspect as well. Now, some of those measures were new, I would say, because no one anticipated something that big an event, which would impact so many countries together. And to that scale, we had seen H1N1. I'm not saying we hadn't seen something, but it was much milder as compared, right? I mean, we had impacts, but not to this level and this kind of extent.
Right.
And even the protocols we implemented were not to the scale, right?
Exactly. Exactly.
Right. So it was very different. Now, when we came to this one, suddenly there were lockdowns announced. Different countries. We saw the same thing coming in India. I mean, it was all of a sudden. And we implemented things at an express speed. Things that we thought will never get implemented actually got implemented. And I'll tell you, for a lot of organizations that were being supported by, I would say, paper plans, well, the situation was very different for them, right? But yes, when you talk about, I would say, resilient organizations, there were plans in place, there were thoughts in place, and there were teams that were put up in place to support that. So that's one thing. Now, of course, when we talk about some of those elements, I think it's more like a tried and tested approach, a strategy that's already in place. So
Right.
it's very easy. The moment, today we know if the government announces a lockdown, God forbidden, we know what to do, and it's just a day's job. You know how many systems, how many people, what kind of protocols, what is it that you need to do in office, because you'll have some people always in office and you'll have some people always at home. So, all those things kind of are in place.
Right.
So it's more like a tried and tested approach, no
Right.
longer that same surprise element that we had, but yes, it is there.
Great. Thank you. Thanks, Neeti. About 2 years ago, when we started or when we went deep into this crisis, I was making this statement and kept making this statement for a long period, maybe for a year also, that no one in the world was prepared for COVID-19 pandemic the way it happened, right? As we
Absolutely.
said that the volume or size or spread was huge
Right.
compared to the swine flu last pandemic that we had, but there were offices continued. There were no
Yes.
lockdowns. That was the biggest difference it brought.
That was the biggest difference. Yes.
So next one will go with Niti first. A request to both
Sure.
of you is, let's talk about, even if you just want to give the name, not even necessarily talking about that, what
Mhm.
protocols were put in place? 5, 6,
Mhm.
7, 10. Perhaps 3 of us should be able to make a list of 10.
Oh, yes. Oh, yes. Oh, yes.
What
Some very
were the,
basics.
yeah,
Some very basics, I would say, the social distancing, the masking protocol, those cleaning protocols in place, especially for your potentially, I would say, the impacted areas, and even for your regular surface cleaning. Even when we were moving systems, either outwards or inwards in the last 2 years, I would say even the surface cleaning was absolutely put in place. And we continue to do that. And I'm sure that's true for most of the organizations, because now we've realized that it can be not just this COVID-19, there could be a viral flu, somewhere sticking to the surface that can make you sick. Right. So we continue to do that. And in fact, a lot of people, when I talk to, from different countries, they ask the same question. Hey, the numbers are going down, the government is not putting anything in place, do you still want us to continue this? So my suggestion to them always has been that please continue with this one. This is a good practice that we should be continuing with.
all right.
So I think some of those have been, pretty standard for us, right? And then whole lot of education that went into it, for our people managers and a whole lot of things. Then there were, isolation protocols that we brought in place. When someone got sick, we ensured that a certain number of days this person isolated, and then we did contact tracing, those first level contacts and second level contacts, and what you call the cab level contacts and cafeteria level contacts, and God knows what not.
Right. Right.
Right. And then even the smoking zones, why we miss that, right?
Which one? Sorry.
So, the smoking zones,
Smoking zones. Oh, yeah.
people always tend to miss those areas, and you would always find them, kind of violating some of the protocols there. Um, I still remember, in one of the instances that I came across, um, I was told that, hey, we followed social distancing. I said, okay, how? Oh, we stayed 6 feet apart. I said, wonderful. But what did you do exactly? We shared a cigarette. I said, awesome, you did the worst. So, those kind of crazy things we've seen happening.
Yeah.
And that's the practical aspect of
And
it.
innocently, that person didn't
So
even
innocently,
understand,
so
realize that
innocently.
he has passed on to me or I have passed on to him or her. Yeah.
Pretty much. That's exactly, what it is,
Being
right?
very good friends.
Oh, people sharing food. Don't even remind me of that, So I guess those are some of the things that we've all been through, and the protocols that we have seen
Good.
getting implemented, and some of them getting violated as well.
Right. Great. Thank you very much. Sanjay, while I wanted to come to you, but it seems she has covered a lot. So if you
No,
don't,
I want to cover something from a different angle.
tell me, please.
So, Daman, I was actually speaking to some of my seniors colleagues. As you know, I'm part of the BCI Mumbai chapter, and we were part of having a conversation with the core committee of the chapter. One of the things that
Right.
really came up, and the core committee meeting dragged on for another 35 minutes, longer than the usual schedule time, is hasn't really COVID been, the question being, hasn't really COVID been somewhat of a blessing in disguise for many of us?
Tell us,
It has
please.
been. It has been, right? For one, work from home. I mean, all of us in the IT enabled sector, we know that we have been pushing the government and everybody else to do away with the OSP license and all its restrictions and whatnot, all the archaic sense of having risks around it and all of the, shouldn't call it nuisance, but all of the rubbish that was there. And we have been pushing it through several industry forums and all
Right.
of that. And they keep saying, no, you can't, there are this and that and implications and risks. And when we try to get deeper, they wouldn't, obviously government officials, the way they react to those things, that they're just going to brush you off. March 2020 proved that it can be done away with it like this. It doesn't create any additional risk. doesn't have any implications if you're really focused on getting it implemented. And I dare say that is one of the things which is now here to stay. Hybrid working model in the IT enabled sector is now here to stay, not only in India, but globally. And we have to acknowledge that. We have to acknowledge that no matter, it's always important to get back to office because of culture, because of collaboration, and because of what we need to do in a controlled environment. Absolutely.
Mhm.
But I think working from home and working in a hybrid environment is now here to stay as part of the working model for the future. I
Okay.
again say immediate future because I don't know what the real future is through the crystal ball, but at least for the immediate future.
Okay.
Now that's a great positive for me because right now, what that means is that work from home is no longer just a recovery strategy, but it's a way of life,
Okay.
Yes.
right? So
Okay.
I see that protocol, which is really a COVID protocol, kind of becoming one of the standard ways of operational, or the way that we operate for the
Right.
future. It's part of our operational resilience model now, right?
Right.
That we have the option to work from home
Right.
during those contingency days, maybe the personal contingency days rather than the organizational contingency days. That's one. The second thing is occupational health and the whole OSAS and all those standards. It has been at the back end or been slightly ignored for a long period of time. We have all been dense packing our desks, kind of getting together, sitting together. Everybody wanted to have higher headcount with less space utilized, obviously because of the high cost of real estate and everything else. We are probably never going to go back to that. I think nobody in real estate is going to go back to a dense packing model. Seat sharing, yes, and there will be a protocol around cleaning, cleansing, and ensuring that personal touch equipments are personal and they are not shared and all of that. But sitting 2 feet across in cubicles, especially like the way that call centers operated or others, I don't think we are ever going to go back to that.
Okay.
Which is healthy. The other things is like some of the things that were really cost restrictive, like cleaning of the aircon filters, making sure that the air that gets in is absolutely healthy.
Right.
The frequency was much higher when we did it. Probably everybody didn't want to get into that.
Right.
But right now, doing it quarterly or even less frequently is the norm. And I dare say it's going to stay as a norm. Again, I use the term for the immediate future.
Okay.
Because now that's been baked into the cost of the organizational operational cost in itself.
Got it.
Over to you, Dhawan.
Thanks, Sanjay. So while it seems, listening to you, that you are proposing or supporting work from home, day before yesterday, Niti and I were in another conference, sharing the stage as panelists.
Yes.
I have different views on work from home, but today I'm not speaking, sharing those views, right? Point that come, you said cost, right? And that's why I picked up this topic, sustainability. Nothing comes free in this world.
Oh,
Whether we say mask, whether we say other rest of the PPE kit, whether we say sanitization, increased hygiene, right? Nothing comes free in this world. I do not have figures with me, right? But I believe that was in Indian rupees, lakhs of rupees, perhaps millions for many global corporates when there are. The biggest that I know today is about 1.5 million people. I cannot share the name of the organization, but that's what the biggest is known to me. Cost is or was huge. I had seen that personally in the last one, swine flu, right? Within months, because the severity was very low, as Niti also had said, we all would agree to that. The severity was low. Within months, these sanitizers disappeared. There used to be one at the reception, another maybe every 100 feet or so we would have a sanitizer, and in the washrooms, etc., disappeared. To me, that's cost, first of all, and we were perhaps less scared because of the severity repeatedly. Even in this time, while it has continued for 2 years, I keep saying this is extended COVID-19 pandemic period. We just started with that perhaps it's not going or it has not gone. June phase 4 was predicted in India. So that's why I'm coming to sustainability of these protocols. What we see today, I'm sharing the live example of this morning. I flew from Delhi to Mumbai. Delhi airport, I had never seen so crowded. Well, the flights are fully functional, when the malls are fully functional, when the cinema halls are fully functional, when the offices are fully functional, then why are we asking masks to be put on? Then why are we keeping the sanitizers also? One is I'm asking why are we doing? Because people are not doing. Rarely some people had, even going into the plane. Person ahead of me didn't have, I had. Person ahead of me didn't have. The lady at the most just told her, sir, please put on your mask also. Normally I would have said today, I don't know how I controlled myself, rather than asking her, why don't you ask him to go back? Why are you allowing this person to go in? And then we had a big function and we have seen people are without masks, 100% without mask. I'm scared as of now. While I participated in that, I had to, but I'm scared as of now. Next 5 days, I'm going to be very, very worried, I would say. Right. So I'm asking these questions about the sustainability of these protocols, whether we say social distancing, whether we say sanitization, increased hygiene, or whether we say the PPE kits, the least is the mask. And both of you can have some views, comments.
Niti, you first.
You know, in terms of the mask, again, I would agree with you on that one. People are kind of messing up with it. And many of them, even if they are wearing a mask, you know, it's more like a formality because you're wearing it under the nose.
Yes.
So which really does not carry any value. It's more like a cosmetic thing than a mask.
We have
So
seen this,
either you are fooling the authorities or whether you're fooling yourself, you know, that only time will tell. But that's a fact, right? From the flights perspective, I'm surprised if you've just taken a flight today, they've not still implemented that. But the last guideline I saw was they can actually tell you to be off board if you refuse to wear a mask.
Yes.
So that's something. Now the guidelines
That's still
come
the
in.
written
Implementation.
Word. That is still the written word, but the implementation is missing. I agree with them.
Exactly. So you have the written word everywhere, but the implementation goes missing. Look at the marketplaces. Even when there were, you know, those peak times, you still saw some people without a mask. You were only wearing a mask because there was a scare. Some policeman will catch you and you have to pay 500 rupees for that.
Right.
Otherwise, there were so many people who were very much willing to remove those masks irrespective.
Right.
I would say people have got tired. I'm trying to be on their side as well. People have got tired of wearing a mask.
And that's the right point.
And then there are all those studies. I'll not say good, bad, crazy, not crazy, but there are some studies which say, hey, you know, the mask is actually not adding a value because you are now moving towards what you call herd immunity and stuff like that. Right. So there are all kind of things.
Yes.
Then look at some point of time, we had a mask selling for multiple times the cost. So you were wearing a mask which was possibly dirtier than what you would not normally use, right? So a mask used, worn out, reworn, and God knows for how many days.
Right.
I don't know how much value it served, but people were doing that. So I think it's important that, you know, when some things are implemented, they are implemented either with the proper rigor or just what you call an eye wash. I don't think that's the right approach, irrespective, you know. So I guess that's where we are. You know, on one point, since Sanjoy was talking about on a lighter note, I mean, if you would remember, you know, when we used to talk about a business continuity professional or a business resilience professional, when we were introducing ourselves in, I would say, personal domains, not many people realized what we were doing. But trust me, when the Prime Minister talked about BCP invocation, suddenly everyone knew a BCF professional. You know, so those have been some interesting developments over the last 2 years. At least people know what you do and who you are,
Right.
right?
Yeah.
And I think somewhere as resilience professionals, we got the respect that potentially we deserved much long back, right? So
True.
Great. Thank you
So
very much.
my view on this, Daman, very quickly is
Yes.
some of the protocols are true value on ads. They have
No doubt.
created the value
No
and
doubt.
they are going to stay because those would be implemented. Masking, as I said, that's the distancing part of it. When you're sitting, the organizational layout, those things I don't think are going to go away. As I said, we will probably not go back to dense packing, and we will have at least 6 feet of distance between our open seating cubicles and all of that. Masking is something that is going to, I think, going to fall away, and it's going to be the way that it has been elsewhere in Hong Kong, in other regions, where if you even have a cold, even if you are just sniffling, you are supposed to wear a mask yourself rather than everybody else. If you have a cold and if you have any congestion or if you are sneezing or coughing, you personally have to wear a mask, and that will probably be an organizational expectation for some time now. Society wise, societal concept, we are in India, we are where we are. There are large communities who don't believe in immunization, who don't believe in wearing masks, who don't believe in social distancing. So there's always going to be a raging debate, not necessarily everything controlled by a Damandev Sood, but raging debates elsewhere in society all the time about necessity of these protocols, and we have to live through that. And
Right.
some of these will definitely fall off, some of this will remain and
Right.
became ingrained in our fabric overall of resilience. That's my view. Back to you.
Great. Thank you very much. Only one difference of opinion here, Sanjay, that it's not only in India, we know other countries also, even actually the advanced Western countries also, people said clearly no, and they were, India at least, there were no outburst, I would say. In those countries, there were outbursts also, going up to an extent of this is a dent on our independence, for example. It's my choice. It's my choice.
Absolutely.
It has happened in other countries. Quickly then, I'm looking at the time also. A request, little shorter responses. I'm still looking at the protocols. One protocol, when we said isolation, which was about 15 days, right?
yes,
It might have reduced to about 7, 8, 10 days now. The question I have been asking this question for about 2 years now. Pandemic, an estimate says pandemic would mean about 75% people may be infected, may be impacted. The moment I get impacted, you say, Daman, stay at home, right? Even if suspected. If found positive, then for sure, right? But even if suspected, Daman, stay at home. In the past, I'm assuming you too also, but you can say, no, Daman, we were not in that boat. In the past, so many times I would have been sick. Sick means cough, cold, fever. These are the symptoms of COVID-19 pandemic. Cough, cold, fever. Right. And I went to office. I didn't stay at home, right? Even if sometimes I wanted to take leave, the boss would say, Daman, it's just cough, cold, right? You have to do work, and I would have gone to office. Now you're saying, Daman, stay at home. You're forcing me to stay at home for 10 days. Who would pay for this? Would it be my leave that would be consumed? Then I wouldn't like to stay at home. Then I want to go to office. Or will you take the charges? The moment we say sustainability, that's the question today. I'm saying quick calculation, up to 75% people staying at home 10 days not working. We know people were working even when they were isolated, and that's some ethical question. I'll touch that a little later. 75% people into 10 days into average daily salary, that is the cost according to me. So is it sustainable? It's to be done. I know that. I'm not denying that fact, but is it sustainable? Quickly.
So that's where I think the work from home and the hybrid working model will come into play, Daman. As I say, I don't have a crystal ball to look into the distant future, but if I can speak in terms of the immediate
Sanjay,
future.
sorry, I'm interrupting. If you say, based on my explanation of the situation or the case, if you say that's where the work from home will come into picture, that means you're saying or expecting, Daman, if you are sick, you actually are working from home.
So I'm going to differentiate that. When you are sick, No, I'm just going to differentiate between that word. But if you are sick, if you're really unwell, then you are expected to take the day off and care for yourself, right? You are expected to convalesce and come back to work. But if you act as you give it the example, if you're having a cough and cold, you're just symptomatic, but you really are not lying down or unwell for that matter, and you want to continue to deliver the work that is important to deliver. There, I think this look, there's no straight black and white answer. There will be these
Yeah,
gray areas
right.
where the organization and the
Agreed.
employee, the employer and the employee have to agree that, okay, I'm not really feeling well, but I still have work. Today, I'm going to work from home and I'm going to deliver on my important key deliverables, and I'll be available to the company, for which obviously I'm going to get paid as well. As I expect, work from home, a few days of it happening in a hybrid model would be not a leave taken or a loss of payments or variables for the employees. That would have to be granted as an exceptional cases for the employer, that maybe with some loss of productivity also, that the employee is going to deliver the critical work and working from home and be productive, even if it's slightly lesser than the office itself. But on those special days, not to be taken as a privilege every now and then, but on those real days where you are really symptomatic, to allow you that flexibility to work from home and deliver your work.
Correct.
Obviously, it will be an IT enabled services privilege. Other organizational sectors will obviously have a harder question, the question that you pose to tackle. What happens in a factory? What do they do? Do they really take the shift off? What is the cost of manning that shift through somebody else? And altogether, those questions will come into play.
Okay.
But probably right now, through while we are dwelling on the IT enabled services industry, this will be the model that I suppose will be in place.
All right. Okay. Thank you very much. Neeti, if you allow me, I'll make it difficult for you.
Please.
Okay. And you're free if you want to answer it different way. You
It's
can.
okay. It's
Right?
okay.
It appeared to me Sanjay's response to the last one was as an employer.
Mm-hmm.
I would like you to play the role of the employee. And then what would be your response or reaction or way forward to this situation?
Okay.
As
Okay,
an
let me ask a question. And in this case, I'm an employee supporting critical operations BFSI for Sanjoy. Okay, Sanjoy is my employer. Okay, Sanjoy, as part of the organization, now there are instances and some critical roles where you are forcing people to come to office because of whatever reasons. You call it data security, you call it the cyber resilience, you call it whatever. You want to monitor me working, and you're making me come to office. Now, since you're making me come to office, what kind of things would you recommend in this case, considering, you're saying that work at home is possibly the easier one, but, many a times I'm being forced to do that. Not work at home, but work from office. And if I'm falling sick, I can relate to a lot of my industry colleagues who actually mentioned that even though I was not given work from home, at a particular time when I had all possible symptoms, I was made to come to office, and I'm talking about the pandemic times.
Right.
This is scary. And I'm talking about someone coming from a BFSI background.
Right.
Now, as an employer, what is your take on this one? You're not going to give me work from home, and you're not going to allow me a leave, because that number of days you can't afford me off. Right? I know there are good organizations as well, and I can refer to several of those as well, where the organizations picked up the cost for those number of days without deducting from your leave, so that people could take rest and then, really come back healthy and, be able to support well. And I can tell you, in terms of the staff satisfaction in some of those organizations, that's been amazing.
Right.
So you have both kind of examples where you push to do so versus the ones where you've been given those kind of support which you really needed in those times,
Good.
and possibly as an employee you're going to remember for your lifetime
Great.
So
Great.
look, if I am
in both
to
the
really,
cases.
Sanjay,
sure, sure.
30 seconds, because I'm looking at time. I have 3-4 more questions for both of
No,
you.
no. So I'm going to answer it very shortly.
Yes, please.
I
As an
can't
employer?
answer.
As an
I
employer?
can't give you. Yes, as an employee.
Good.
As an
Yeah.
employer, I can't answer you in differentiating between an ethical employer and an unethical employer.
Absolutely.
That is, I won't tackle that. What I can tackle is in having office critical stuff, the way that you mentioned that office critical
Right.
stuff, certain functions which compromises data privacy or privacy of data, of client data, and otherwise, if
Mhm.
I need to work in a controlled environment, I will need to have a controlled environment, and I will to some extent expect my staff to balance their well-being versus the office critical work in order to be in office in some way or the other. Now, as I said, it's a fine line and there is no black and white answer. There is a
Agree
lot of
with you.
gray in there.
Agree with you.
Certainly, so especially in the BFSI, in certain areas, at certain days of the month, certain days of the quarter or year ends, etc. Yes, as employers, donning the hat of our employees, we do push employees to come to office and deliver on the critical work, even if they are going through personal hardships. Let's
Right.
just call it personal hardships. So that's not going to go away. That's going to continue because the organization would have their organizational objectives and goals to also live up to. But an ethical employer would probably draw the line and really make sure that they take care of their employee well-being and their health as a paramount, as objective and goal number one.
Good.
Before anything else that comes into play.
Thank you very
Back
much.
to you,
Let
Daman.
me- yeah, let me pick up another protocol that was put in place, or it
Mhm.
was treatment, if you want to call it treatment, vaccination. And I'm repeating,
Oh,
nothing comes free in this.
I was
So-
going to talk about that.
okay. Okay, so first,
Yes.
we will
Awesome.
request you to go first. Vaccination. We know currently it is free in India, for example. Maybe many more countries, other countries also have made it free, but it was not free in the beginning and it was very costly also.
Right.
So initially we had to pay, we paid from our pockets. Later on, many organizations, not one, two, many, perhaps most organizations picked up the cost of the vaccination for their employees. Then they extended to employees' families also. Then some extended it to their contract staff also. Maybe there is a rare case, which is not known to me, when it was extended to contract staff's families also. But there was an expansion, there was expense, sorry, to that. There was a cost associated with that. Again, I do not have any figures from any companies. I had done some rough calculations separately available for India as a country, for the government. If government had to make it free, which was the expectation, right? It was coming out to be billions and billions of rupees. So if we have done it currently, assuming that sustainability, if something like this happens once again, it could be a different pandemic for which we may have to have again a new vaccine. Your views on that sustainability of this once again?
So if I might go first on this, see, I have a slightly radical view of this. My view is very clear. Those of us who can afford to pay for the vaccine should simply pay. I can give you my employer reimbursed vaccination cost. They did camps and also reimbursed vaccination costs for me, my family, and everything. I didn't avail of that opportunity. I went ahead with my family to paid centers and got myself vaccinated and paid for it.
Good.
I don't expect my government also to subsidize it because I am able to. I would rather that those resources are moved towards supporting people who cannot afford to pay. Why support somebody who is able to afford the cost of vaccination, that 800 rupees
Sanjay,
or the 1200 rupees?
Sanjay, please allow me to interrupt. I'm still saying, as an employer, how much did you spend? Do you have budget? It was not budgeted. Most likely, no organization had budgeted for it.
No.
So it was an additional expense that was done. will the organization be able to do it again next year or after a couple of years if something like this happens once again? That's the question I'm asking.
So
Sustaining.
the question,
there's
some
there's one more point.
organizations have been supporting even flu shots, right, in the past, who were subsidizing other immunity boosters and etc. So certain organizations will be able to do it because of the scale, because of the wealth that they have, because of the resources that they have. They'll be able to sustain even the hit on the numbers on the cost of vaccination of,
Okay.
as you said, not only employee but staff and their families. Some small schemes would not be able to. And that is where we have to level set expectations. Over to you, Niti.
Yeah, just one little point, Sanjoy, on that one. I think many good organizations actually supported their staff members in terms of availing the vaccination facility, and which is good, even when they were expensive and scarce, to a level when they have been available and easily available as well. So which is a positive. And I agree with your stance of, if you can afford it, why not go for it yourself, so that the resources are made available to others. One good part, I think, is also in terms of the policy part of it, which is, you could offset a lot of that cost against the CSR budgets in the organizations, which means though you picked an added budget, you could offset it against a mandatory expense that you were anyways supposed to incur
Or a tax shop.
during, or a tax off. Yes, absolutely.
Right. Okay. Yeah. Okay. Quickly then. This is going to be a little serious
Yep.
question according to me, or
Yep.
this is
Yep.
a serious question according to me. Once again, we are looking at the protocols of COVID-19 pandemic. Use of PPE kits and use of masks increased by what percentage? 100%, 1000%, or maybe 10,000%. Along with that, whether we work from home or from anywhere else, as we have been saying, hybrid working or remote working, the use of electronic gadgets, which may be routers and the desktop laptops, that also increase. Question is still around this. So this is I'm calling a protocol to manage COVID-19 pandemic, masks and laptops, desktops, electronic gadgets, which means increase in the medical waste and increase in the e-waste. I'm saying, if I'm taking my own example, if I am a business, I was a business, I did that to sustain the business. Was it ethical? Did I increase my capacity of processing that medical waste and e-waste appropriately, accordingly? When I say me, I'm including me, the organization, the municipal committees, the countries, also the producers. We know there is something called EPR, extended producer responsibility, when it comes to e-waste management. But who is doing how much and how much did they do? They were just selling out, according to me. So both me as well as the person who was selling it to me, were we doing ethical business? Once again, is it sustainable?
Great and important question, Daman. I think there's a lot to be done in that regard. While we have focused so much on all the health aspect of it, the carbon footprint, the e-waste disposal, and all these things that you really raise as a question is something that we all need to look at as a professional organizationally as well as personally. Definitely something that's going to harm us in the long run. Maybe we are short-sighted right now. I don't have an answer to your question, Daman. We haven't done enough. That is definitely, I don't think there's any disagreement on that. What we could do more and what we should do more in the immediate, that has to be really chalked out by professional, because we have to have a balance. While we all need our gadgets and we need our devices, there has to be a limitation on how we use this and how we dispose them. Most importantly, when we dispose them. Even personally, I still, at my own home, my daughter still hangs on to her first phone as a sentimental value and doesn't want to dispose of it.
Right.
I mean, these things do happen. We are, so we need to really have that education ingrained amongst ourselves
Right.
societally. I come into again to the societal concept of this
Right.
and how we tackle this. Now it's just not no longer an organizational or a municipal or a government issue. It's a very important question to ask, and there is a lot to be done in this regard. Over to you, Nitik.
Thanks.
I agree with you on that one, Sujay. And it really comes with, as I said, with great stuff, you got greater responsibilities, right? You were able to sustain with certain things, but there are greater responsibilities that you need to meet. And that essentially means a lot of education around it, a lot of sustainability efforts around it to get the things in shape. I would again come back to, the same point. There are organizations who are doing it. I can't comment whether they're doing enough or not, but there are organizations who are still, doing that, disposing of their assets appropriately,
Right.
medical waste appropriately, and things like that. But yes, lots and lots needs to be done. We are still when we talk about, we still restrict ourselves to the bigger organizations.
Yes.
There are many, many, many smaller organizations who
Right.
don't even know what they need to do.
Exactly.
And I think that kind of an education is even more important.
Exactly.
I may be doing it because I'm aware of it. My organization may be doing it because we are aware of it.
Right.
And many similar large organizations may be doing it. But when
Right.
it comes to a common man,
Right.
or maybe a small time office with 5 or 6 systems,
Right.
possibly they may not even know that something like this exists.
Right. Yeah. Good.
Right. So those kind of mandates have to come in place.
Yes. Great. Thanks, Niti. The challenge that I understand, I know little, I would say I wouldn't claim that I know a lot and all. That the best that I do, I'm talking of an organization. We are not talking of personal space, but that's a bigger challenge. But that volume is in the organization also. That's also a fact.
Yes.
The best that we do in the organization is that we segregate the waste, right? Paper waste, now medical waste also added. What happens when it's taken out of my organization is none of my business, is not my headache. I do not know what is happening. So I'm raising the question, whether I increase my capacity, maybe yes, I have done little. But then once it goes out, it goes to municipal committee. Have they increased their capacity of processing this? And then I'm going back to the producer also. They are worried or bothered about only producing more. The last one to both of you, and quickly, please, very quickly. One more protocol or one more change that happened was, and I was surprised at an internal audit to an organization when this came out. We were talking about evacuation drills. And they said, the last 2 years, evacuation drill has not happened. So I said, then perhaps this will come out as a finding for you. Daman, we got an exceptional approval. There were no people in the office. I said, there were not no people, there were less people. You are telling me there were some people in the organization, at least IT people, for example, even if the strength was reduced for IT people also.
Yes.
When the moment you say there were some people in the auction, evacuation should have continued. Why did we stop it? That means those people were not important or their lives were not important. We should have tested, actually, perhaps a lot more learning would come out of that action. So quickly, 30 seconds each of you. Then I'll give you some good news at the end of the discussion.
Niti, you first.
Wow. I agree with you, Daman, that some of these protocols have to be maintained, and I think that's the real test as well, because one, you are also testing your scale, whether you were doing it at a smaller scale, and suddenly when you're moving to a larger scale and possibly a much larger scale as you grow. So I think those protocols should continue to be tested, and those gaps should continually be identified. And I'll not just limit myself to evacuation. I'll say even your equipment has to be tested. And that's about all your fire suppression systems to alarms and everything, because everything gets tested during those evacuation drills or some of those exercises.
Agreed.
So not just the human element, it's a technology element as well.
Yes, yes.
So I have a slightly different view on this.
Yeah.
My different perspective is that the technology element, the training and the awareness elements is absolutely a must do, and it should be done even through stress situations like COVID or any contingency for that matter, any extended outage scenario. But the people element of it, I think there is reasonable cause enough to grant an exemption, even for a strategy like people relocation, moving from one location, one city to another. I think even major organizations have not tested that during the last 2 years in having people to travel from their home location to another city to test out, moving the people and not the work. So, and I think exemptions for fire evacuation drills or any evacuation drills for that matter, from a people perspective is understandable. Even if it is not a best practice, it is understandable. But what Niti mentioned, the technical aspect of it, testing the desktops or the overall setup at the other alternative location, or testing the fire suppression and all those agents in the offices itself, that cannot be exempted. That cannot be given an exceptional from testing. Back to you, Daman.
Thank you very much. So to end the conversation this evening, this is the great debate we were having. Episode 7, the topic we had picked up was the sustainability of the COVID-19 pandemic protocols. I would like to thank both the speakers, experts who spared time for us, and I would like to clap for them. The recording is available, will be available to all if you want to go through. The good news that I wanted to mention was, this was a super Saturday for me, so packed. I had to give up one of the activities. 6 to 7 this evening, I had a session. I wouldn't say interviewing, but just like you two, live in chat with that person, solution to pollution. If anyone would be concerned about pollution, which could also be a disaster, we know it's already, perhaps someone would say, I will agree with him or her. In Delhi, in NCR, in India as a whole, that was the session. I couldn't attend. We invoked BCM, by the way, in that also. I requested someone else to do that. Session did happen. So that recording is available. This activity and other two also that I'm going to talk about quickly are from IEEE platform, Institute of Electrical and Electronics Engineers. I'm a senior member there. And we do a webinar every Saturday, 6 to 7. So solution to pollution happened today. A technical logical solution, very good discussion. I would know, even if I didn't attend, I will watch the recording. I'm requesting all viewers also to do that. Links available easily, can be found. BVI CAM webinars, or you can ask me. The second one, next session from the same platform, is going to be the e-waste management. I'll be talking to, once again, an expert agency who will tell us how to do, what to do, and how can they help us to do. Today, I'm struggling actually to find someone who will recycle my e-waste. All right. And the next, the great debate, which is going to be Saturday, 25th, I believe. Yes, it's 25th of June. I'll be talking to another expert, and I'll request few more to come, but at least one expert is coming who is doing this solid waste management, which once again could be a big disaster for us. So these are 3 good news that I wanted to end the session with. Thank you very much once again. See you.
Thank you for having us, Daman, and it's nice catching up, Niti. Thank you.
With pleasure. Certainly, the pleasure is all ours, Daman and Sanjoy. It's been an amazing discussion.
Thank you very much.
Thank you. Have a good evening.
Bye-bye. But without you two sparing time, it wouldn't be successful. So once again, thanks to you.
No, thanks for arranging.
Thank you. Thank you so much.
Both of you.
Bye-bye.
Bye.